This video provides information on Nyquil cold and flu. Nyquil cold and flu contains 650 milligrams of acetaminophen, 30 milligrams of dextromethorphan, and 12.5 milligrams of doxylamine, all in one liquid capsule. So because Nyquil cold and flu has 3 different active ingredients, it also has 3 separate mechanisms of action for each active ingredient. So acetaminophen reduces your pain by decreasing prostaglandin production and increasing your pain threshold. It'll also reduce a fever by stopping the production of fever-producing substances in the brain. Dextromethorphan will relieve your cough by increasing your cough threshold. Doxylamine is an antihistamine that reduces any allergy-like symptoms such as a runny nose or a scratchy throat by blocking histamine. Nyquil is indicated for control of symptoms in patients with a cough and cold. If you want to get Nyquil for your child, and your child is below the age of 4, do not let your child take it. It is not an appropriate option for them. If your child is between the age of 4 and 11, consult your child's pediatrician before allowing them to take Nyquil. Any patient above the age of 12, including adults, should take 2 caplets by mouth every 4 hours as directed for temporary relief. Additional instructions for taking Nyquil are take no more than 4 doses of Nyquil per day, and do not consume more than 3 alcoholic beverages per day while taking Nyquil. A couple of things you want to watch out for while taking Nyquil are adverse effects and potential drug interactions. The main 3 adverse effects associated with Nyquil are dizziness, drowsiness, and nervousness. The only major drug interaction you should be concerned about with Nyquil is with monoamine oxidase inhibitors such as phenelzine and seligine. There are 3 main reasons not to take Nyquil and consider a different product instead. Number 1, if you're already taking a product containing acetaminophen, Nyquil may not be the best option for you because you run the risk of acetaminophen toxicity. Number 2, if you've taken a monoamine oxidase inhibitor in the past 2 weeks, then Nyquil may not be the best option for you because of that drug interaction with monoamine oxidase inhibitors. Number 3, if you have a productive cough, or in other words, mucus comes up whenever you cough, then Nyquil may not be the best option for you because dextromethorphan, the cough suppressant inside of Nyquil, can't treat a productive cough. Exclusions of self-care for cough and cold include if you have a liver disease or heart disease, if you have a medical history of high blood pressure, if you're currently suffering from thyroid disease, if you have diabetes, if you have difficulty urinating due to a swollen prostate gland, or if you have a cough due to a chronic condition such as asthma, emphysema, bronchitis, or smoking. If you have any of these exclusions of self-care, Nyquil is not an appropriate option for you, and you should consult your doctor in order to find an appropriate option. Stop taking Nyquil and consult your doctor if you experience any nervousness, dizziness, or sleeplessness, if you persistently experience a cough, congestion, or pain for 7 days, if you persistently experience a fever for 3 days, if you experience redness or swelling, or if you notice any new symptoms, or if you experience a cough with a rash or a headache. If you experience any of this while taking Nyquil, stop taking it and ask your doctor for another medication.